All right, am I audible? We shall start. Right, thanks, man. Uh, right. A very good evening, first of all, and a heartiest welcome to one and all present here. As Sattva marks 10 years of service to humanity, we stride ahead, inspired, with renewed vigor, to give our best to the world as holistic healthcare workers. Now, we all know the importance of psychological status assessment in terms of case taking. The mental state examination, also known as the MSE, is an integral and essential skill to develop in a psychiatric evaluation. The undertaking of an accurate MSE helps elicit signs and symptoms of apparent mental illness and associated risk factors with the assessment. Gracing us with her knowledgeable presence today is our one and only Dr. Neha Patel, MD. Dr. Patel is the Assistant Professor in the Department of Case Taking and Repertory at Srimati CMP Medical College, an honorary consultant at Sri Mumbadevi Homeopathic Hospital, as well as a distinguished physician. After completing her undergraduate studies from Srimati CMP Medical College, she pursued her postgraduate studies in homeopathic psychiatry from Dr. M.L. Dhavle's Memorial Homeopathic and Research Institute. Her postgraduate dissertation received a Quality MD Dissertations Award from the CCRH. Her laurels include a presentation at international and national seminars like the Ayush Expo for the World Homeopathy Day, the International LMHI Conference, along with peer-reviewed articles published in international and national journals. Her legacy also includes presenting cases for numerous symposiums and hosting informative workshops for students. Welcome, ma'am, and thank you for joining us. Also, please feel free to post your questions in the chat box if you have any. They will be answered after the session ends. Thank you, ma'am. You may commence.
Thank you, Sagar, for the introduction. Good evening, one and all. I hope I'm audible.
Yes, ma'am, you are.
I have shared my slide. Is my slide visible? Thank you, Yash. So once again, good evening, one and all. Today, I'm here to present my topic, application of mental state examination in homeopathic case taking. So, as rightly said in the introduction itself about the mental state examination, today we're just trying to understand how do we link it to the routinistic homeopathic case taking. Case taking is something that we usually do day in and day out. Since there are few of them who are still joining, we would start the session with a question. And I would also like to make this session more interactive, okay? Because it's a Sunday evening and I understand and really appreciate all for joining. So I'll make the session more interactive rather than a one-way session, okay? So first and basic question, you can either unmute and answer or answer in the chat box. So case taking is something that is the base today. So in the organon of medicine, what are the aphorism numbers that deal with case taking? Yeah, that's absolutely correct. 83 to 104 are the aphorism number that deals with case taking. Perfect. With that, we move on to the next question. Which aphorism numbers are related to mental symptoms and mental conditions. Correct. 210 to 230. Great. So, what I'm trying to say here is the topic today that we're dealing with, mental state and case taking. Both are nothing new for us. Both is something which is already mentioned in our Bible, the organon of medicine. Okay? But still, I have a question. Do we understand, take, or evaluate a mental state while we're taking a case? Yes, no, maybe. You can unmute and answer or answer in the chat box.
Yes, ma'am.
The question is in the process symptoms. Do we include the mental state? Yeah. Yes, Agri.
Ma'am, if it is a rule out if it is a pseudo mental disease or true mental disease, or it is a psychosomatic or a somatoform, or like in order to if it falls into any of those categories, and if there is a clear mental ailments from as far as the like the reasoning goes, and also if you want to look at a holistic disease presentation in terms of the totality, and as Dr. Kent said, if you want to look at the man in sickness and not just the sickness in man.
Okay. Do we have any other inputs? Yes, Bhagyashree? Any other inputs for the same? Okay. With that, I move on to the next question. Difficulties that you'll face in understanding mental symptoms during case taking. Mental difficulties, yes, no, if yes, what are they?
Ma'am, could you please repeat the first part of the question?
Taking. You don't face any difficulties at all. They're easily available during case taking. You can easily note it down. Okay. You can either unmute or answer in the chat box.
ma'am, sometimes interpreting the mental state is a dicey situation because we have to look at the underlying themes the patients present in, as opposed to just the words which they utter. So what the patient means to say could be something completely different and left to interpretation.
Okay. Any more inputs? Now, what just Kunal rightly said that many times interns and students come to us saying that the patient was not saying much. So that is the reason they could not understand, they could not take the mental state in that particular case. So these are the difficulties which are commonly faced. Okay? Correct. Now, age related issues are also seen. Which brings me to the next question of what is your understanding of a mental state examination? Because we talk of mental state, we talk of mental symptoms, we talk of mental symptoms and the diagnostic picture relating to it. So what is a mental state examination? Yes, even in pediatric age. Correct. Can anyone just share their understanding of a mental state examination quickly? Correct, pediatric age group. Okay. Any more inputs about the mental state examination? So basically the objective for today's session is to understand the mental state examination and link it to our homeopathic case taking. Now there are two objectives. One, that each student and intern understand the mental state examination because it is very important. Post-COVID, there are many patients who are basically suffering from some of the underlying issues. Okay, they usually don't come up as disorders, but there's certain states which are definitely predominantly seen. Now, evaluating those become very important. That is why I feel each student and each intern, even in the undergraduate level, must understand a mental state examination. Okay, because that will help us evaluate patients better and also help them, provide them with the need that is required, because not all can reach out to each patient. Nextly, the next question is already answered, that our homeopathic case taking is not something very different. In that homeopathic case taking, we anyway include mental symptoms and mental state. While taking a case itself, we are including it, but we are not examining those mental state. Okay, we're trying to understand the perspective is different. We are focusing more on understanding the mental state, understanding the patient as a person, and understanding what are his reactions to different situations. We are more focused on coming to a remedy. Here, we are just trying to understand the mental state examination today. Also, with this, the very difficulty that my students and intern face, that just like what Kunal said, that the patient was not saying much, he was a little reserved, he could not get more of a mental state. I always tell to all my students and interns that it's the very first time that you are talking to the patient. It's a very first encounter with the patient. So it is not always that the patient will trust you and give you all the information that you are looking for. So understanding a person takes time. Likewise, understanding the patient also requires some time. So it is not always in one go that you kind of get every data that you're looking for from the patient in terms of understanding the mental state. So that needs to be understood. Okay. So today, as I said, while talking about this mental state examination, you will understand that it doesn't require much of an effort to understand a person. There are certain basic things that you all are any which way doing it, but you are not focusing it. So next time when you all are taking a case, you all will be focusing in on the terms that we are discussing today. Okay. So what exactly is a mental state examination was my question, and Sagar rightly answered it. Just to give a brief idea to all those who have just joined, here we're just talking of it as a structured way of observing and describing a patient's psychological function at a given point in time. Okay? So basically, when we're taking a mental state of any patient, we are asking questions. Either they can be structured or non-structured. Mostly what students and interns have is a non-structured way of asking question. Okay? So here when we put this pointers in the mental state examination, it is more structured way in which you are questioning, observing and understanding the psychological functioning of the patient. Okay? Also it deals with different domains which will be taken up. So the first thing, as it says, that in one section, if you're taking the case for the very first time in a cross-sectional way, you're just trying to understand the mental state at that particular time, at that particular moment. Okay? It may not tell you about the patient as a whole together, but it definitely gives you details about the mental state at that particular time. Right? That brings me with the next question. When does your case taking start? At what point in time does the case taking start? This was also a question which was put to me or asked to me by a very senior consultant. That when do your case taking start? Absolutely correct. Okay, your case taking does not start when you sit with your patient to ask question. It starts right when the patient enters your clinic. The way in which your patient is entering your clinic tells a lot about the patient. So the very first thing that we're talking of here, this is a beautiful example. Suppose if you're just looking at this picture, okay, what can you talk about this particular girl here? If you're
Reserve,
visiting, Okay. So if you're visiting as a doctor and the mother says that you're just sitting like this for days together, not talking much. Okay. So what I'm trying to tell you is just one look tells you a lot. So more than asking questions, it's worth to wait and understand what the patient is sharing without even talking to you. So the very first thing is that you observe. So what do you observe? What do you observe in a patient? As you rightly said that it starts right when the patient enters the clinic. What all things do you observe? Facial expression, yes. How he walks, talks, yes. Body language, yes. Gait, yes. Correct. So just to brief it up, the very first domain is the general appearance. Okay. As I said, it's a structured way, so we'll put it in structure. The first thing you observe is the general appearance of the patient. The next thing is the behavior, how the patient is behaving, not just with you, but also if the patient is accompanied by someone. So with the accompaniments, then if there are students and interns in the clinic or in the OPD, how are they behaving with them? So overall behavior is what we're talking of. And the third domain is the psychomotor activity that we're looking for here. Okay. So there are first three domains which are usually something that can be easily observed. Okay. The general appearance, the behavior, and the psychomotor activity. Fine. Now, being from the Department of Case Taking and Repertory, the session cannot just go without bringing up sub rubrics, right? So the only thing here is you all are not going to immediately answer. You are going to wait at least for 1 minute, even if you all know the answer, so that others also get a chance to look into the symptom. Now, the very basic thing here is you all can use any app. Your favorite is the synthesis app, so you all can use that also. So the first symptom here is the patient comes to your clinic, and right from the first look itself, you all can make out that the patient looks older than his age, older than the age mentioned on the case paper. So what is the rubric? You can answer in the chat box. Yes, okay. Anything very particular to the symptoms? Okay. Come on, I'm waiting for responses. The 1 minute is over. Please be quick. Old age premature. Okay, yeah, correct. Okay. Moving on to the next. So right when the patient enters the clinic, he looks very anxious. And it's not just the anxiety, so anxious that is also perspiring. And it's more seen on the face. Anxiety with perspiration in the face. Okay. So you can quickly answer. I'm waiting for responses here. Perfect, Sagar. Since you're looking for a specific location here, face, perspiration, anxiety with. Hope you're also noting the amount of remedies given there, okay? Because these are worth looking for, especially the next time when you're observing your patients. Just by observing the patient, this was something that was noted. How will you locate the third symptom? Very good, Talat. Not all know that there's a rubric given called obesity in the generality section, and there is specificities given to that rubric, which is very marked. You all must really go through the sub rubrics given in this particular rubric to understand it better. Okay? This I think Gulab can answer because I've taken this in the class. So in a very hot summer like we're having now, May in Mumbai, still the patient is wrapping himself in fur. Hot summer afternoon. Okay, great. Nobody will ever make out that it's given in the chapter mind and the main rubric is fur. Okay, it's very unusual for anyone to think that there can be a main rubric for and that to a chapter mind. Yeah. This you all can see in adults, adolescents, and also in children. So there was someone just mentioned that in pediatric age group, taking mentals is difficult, but in pediatric age group, there are more of objective symptoms that you can easily get. Okay. I really thought that this one was easy. So you can notice patient waiting in the waiting area and how are they waiting. So here the patient was so restless that he was walking to and fro in the waiting area. So it's not just restlessness, as Dr. Ken says, qualifying a mental symptom. So the restlessness is qualified here. This one's very easy. Come on, be quick. I'm waiting for responses. Please be quick. Correct. So many times we don't really go further to some symptoms or some states like restlessness, anxiety. We are all okay at that. But we don't qualify it much. So you all must have to understand that qualifying each symptom is important. As I said, you're not just observing the appearance, the behavior, but also the psychomotor activity. This can be a complaint or it cannot be a complaint, just an observation that the physician is making. Now we are locating ticks. Great. It's again important that the gestures that your patient is making. Most of the time, we when you talk of observing, as you said, you all just mention about the facial expressions, you all mention about the walk, you all have to understand the mannerism and the gestures are also equally important. And you all have a rubric of gestures in the chapter mind itself. Okay? So many times we miss this. This can be easily observed while taking a case that the patient is sitting with stooped shoulder. Generalities, yes. Also, I hope you are taking a note of the chapters that these rubrics are located in. Okay, here we are not talking in general. You look for such rubrics in different chapters, not the chapters that you are actually looking in, like for in mind chapter, stoop shoulder, and generalities. Okay, these are not the usual chapters that you will locate. The next thing is what I wanted to mention here is with the complaint also there is observation which we usually miss out. Now this was a patient that came to my clinic with basically a GI complaint that he was having. Okay. Along with that, what I just observed that each eructation that she was taking very loud. So how will you locate this? So it is not just that you're observing the person, we're also trying to understand the complaint and what are the changes that the patient is having with that complaint. Yeah, correct. So it's not just an eructation that we have loud, we have eructation type which is loud. Okay? Very common, especially in the summer. I have few patients coming with just this complaint saying that the face has got tan, it's not looking good, and if there's some remedy which could just help that tanning. This can be a complaint or this can be just an observation. Correct. It's directly given. As I said, along with the complaint was cough. The cough was of a barking type. It's very easy. It's direct. Cough, barking. Correct. This is something that you must have noticed in many patients. Okay, this may not be a complaint, but you'll see that there are some people who have a tendency to constantly clear their throat and they make a certain peculiar noise while doing that. So where will you locate this? The tendency of constantly clearing their throat. This can be observed around in patients, person, also while taking your case. Correct. So there's a direct rubric, okay, where the rubric itself says that disposition 2. Yeah, we'll have to make a note of that. Then a pediatric age group. Come on, be quick. This can be either seen in children or even adults for that matter. I had a case where the mother was complaining that a girl will just pull the hair of people sitting around. Because of which there was a lot of complaint. The school teacher was complaining that she's pulling hair of students sitting. Pulling hair of bystanders. Yeah, it's directly given in gestures. We move on directly to the next domain. Sorry. We move on directly to the next domain, that is speech. Okay, so after observing, the next thing that we look for is the speech. Now, do we have rubrics related to speech? Yes, clear. We definitely have rubrics related to speech. Now, what I want to mention here that you have rubrics related to speech even in mind section. I will request you all to take a minute, go to the mind section and see the rubrics related to speech. Because when you're talking of speech, that is not the usual chapter that we go to. I hope you are done looking at the rubrics. Also, the sub-rubrics in mind section related to speech. Just few examples that what do you all basically have to notice in speech. Like you can go through definitely the sub-rubrics, but I've taken two examples here. One is slow speech. So, how will you all... Right. So, here we are talking of slow speech. How will you all locate this rubric? Directly. Mind, speech, slow. Great. Now, when we're talking of speech, what I want to make a point here is we're not just talking of speech, we're also noticing the quality of voice, the type of voice. Yeah, it's a low, soft voice. Okay? So I hope you're not just looking at the speech, rhythm, the quality, the type, all of it can be as a part of your understanding in a mental state here. Okay? Fine. Take the next domain, that is mood and affect. Okay? So I don't think anybody will disagree that mood and affect are given as rubrics, and understanding the mood and affect is also very easy. Now, when you're talking of mood, we're talking of the mood which is there at that particular time. So it talks about the mental state at the time when you're taking the case. Okay. Now, suppose if you were late, the case paper was there in the OPD, and you all are going for taking a case after half an hour, definitely the patient is going to be angry, right? So all of it talks about the mental state. Fine. The next domain is thought. So after understanding the mood, the next thing that we talk of is thought. Now there are certain things that you'll have to specifically look for when we're talking of thoughts. You all must not miss out on ideations, whether it's homicidal or suicidal. Then these are easy, the obsessive and the compulsive, whether it's both or separate. Those type of thoughts. Phobias you all are definitely going to look into, but that is something that you'll easily pick up. Here is something that either you can ask as a direct question. Most of my students and interns ask that is a question. And delusions, if any. Okay. Now, this can be a homework. You can look for these rubrics. We move on to the next domain, that is perception. Fine. Now here I have a question for you all, because this is the question that most of my students and interns have. Delusion, as I said, is a part of thought. When we talk of perception, we talk of illusions and hallucinations here. So I want you to help me with this. Match the following and tell me what is a delusion, illusion, and hallucination, preferably with examples, so that we can clear the doubts right here about what is a delusion, what is the illusion, and what is the hallucination. Come on, quickly. Absolutely correct. Okay. So the one which is left is definitely an illusion. Okay. So as I said that always remember that when talking of delusions, we're talking of a thought process wherein there is a false belief. Okay. It is a part of a belief which is going wrong somewhere, and that is why the person is having a delusion. Fine. And when I talk of illusions and hallucination, it's very clear. Fine. Suppose if there is a rope, there's a very simple and easy example which has also been narrated in many of the books, that if there's a rope and a patient mistakes it for a snake, it's an illusion. Okay? But if there's nothing at all, there's just like everyone just mentioned, there's no object, there's no stimulus, but still the patient feels one, then it is a hallucination. Okay? So when there's nothing, in absence of anything, feeling of anything is a hallucination. And when you're mistaking or misinterpreting something, it's an illusion. And when you're having a false belief, it's a delusion. Okay? The next domain is memory, attention, concentration, and comprehension. Fine? Now, this is something that we usually don't talk of, or we usually don't inquire in a patient. Fine. Many times, many of the patients will tell you that they tend to forget things. Now, in pediatric age group, the mother will say that he's having problem with attention, concentration. So all these are given as rubrics, direct rubrics. You all must really go through the rubrics and the sub rubrics. It will also improve your case taking. So this is easily given, easily available, and nobody. See, when you're talking of a mental state, this is something that anyone will be easily sharing it, even in the first case taking itself. You know, if you're meeting that patient for the very first time, when you inquire about the memory, the attention, the concentration, or even the comprehension, if you're judging it, it's very easy because the patient is not going to lie about it. When you're talking about the other emotional states, the patient may get a little defensive and say that no, nahi, itna nahi, gussa aata hai, but not that much. Okay, so I hope you understand that those things are usually covered up because no one wants to share it that easily. But these things that we are talking of is not something that they will try and cover it. Okay? This is something that they will be readily sharing it with you. That okay, yes, there was a problem in memory. They're really seeing something. There's something difficult in the attention, especially after the long COVID. So just quickly take this. Many times you must be noting it, whether it's patient or even friends, they said that they just forgot what they just said. Come on, be quick. Patient just forgot what he just said. Yes, how will you locate this as a rubric? One be quick. Okay. Any other inputs? Any other rubric? So I hope you'll understand the difference between the two rubric mentioned in the chat box. Yeah. Forgetfulness to words while speaking. So while speaking, so it's an act which is in continuation, which is happening, and there's forgetfulness. And this is something which is said, what has been already done. Okay. This is very easy. In the same thing, this can happen to students also. Many we just pada, but I just forgot. During the exam, I could not recall it. I could not write it well. I just read it a minute ago when I entered the examination room, but I still forgot it. The last minute reading that you'll do. Yeah, so I said this is very easy, directly given. So what I'm trying to tell you all here is this is directly available, something that you all must look into, because these are some of the areas which you are usually missing when you're taking a case. These are some of the areas which are, although easily inquired, easily observed, but they're still missing. Now your case taking, the booklet that you'll have directly mentions the general appearance. What I usually get is the wheatish discoloration or wheatish appearance, and that all sort of stuff is which is very general is something that we bring in up there. So I hope after this structured domain session there's some improvement that we see there. Okay. And all these things, as I say, are easily noticeable. I still remember my days of internship when we're sitting in the OPD, there are patients sitting in the waiting area, right? Just from observation, we would just note some down and we'll try and find some rubrics related to it. It was really something that we enjoy doing, which I somewhere feel is very missing nowadays. So I hope that you all really become a little inquisitive, notice what is happening around, try and understand stuff, put it down as either a state or a symptom and try and convert it into a rubric. Yeah. The next is judgment. Now, here we're talking of the judgment that the patient have about his or her complaint. What is he or she, suffering from? This is usually important, especially when we're talking of a psychiatric complaint, because many a times they're not able to zero down in understanding or concluding to what their some symptoms come up to. As Sagar rightly said in the introduction, there are many psychosomatic cases also. Now, we can easily understand while taking a case that it's a psych and the soma that is affected, and there can be a causation also. But connecting the dots for the patient can be difficult. Okay, so you just have to understand whether judgment is there or not there. The last domain that we're talking about is insight. Okay, whether the patient is having an insight to the complaint that he or she is suffering from. Now, this is again important in psychiatric cases because they usually deny. saying that they don't have any complaint. Even with anxiety disorders or depression, many a time the patient deny that they're not that anxious. It's just a little amount of anxiety that they're having for some reason, but it is not really impairing or something that requires any medication or any help also for that matter. Yeah. So these are the 10 domains. I hope you all will look for these 10 domains in the patient. Now, what I wanted to mention here is mental state examination. Although we usually, when the term comes, we say that we do it only for patients who are having any psychiatric complaints, which is not really so. It is mental state when we are taking any homeopathic case where any which ways including mental state and symptoms. So including these 10 domains is very easy. Also, the examination of these domains will help you understand the patient better and also will answer your questions saying the patient is reserved and not having more symptoms and you cannot get much of an understanding. This will help you to at least get some of the basic understanding of the patient. And as I mentioned, the very first objective that when you're noticing all these domains in a person, suppose when you're looking for anxiety, like one of my intern Abhishek Gupta did a very good work on grief. Okay, so when you're looking or taking a patient who have actually been through an event and is still grieving or the process of grieving is incomplete or has been impaired, so you can understand the difference. Yeah. And as I said rightly that after COVID, there are many patients who are facing this difficulty. So if you just run down these 10 domains very quickly, it will help you understand the mental state of the patient. And also in some way or the other, it will help the patient where you will just try and make the patient understand of the complaint he or she is having to get some help. Yeah. With this, I conclude my session. I really thank you all for being here in a very Sunday evening, considering there are no public holidays in this month. Sparing some time in Sunday evening is very difficult, I understand. So I really thank you all for listening to me. I would thank Satwa. Also, I would like to congratulate Satwa for completing the 10 years. I would thank Dr. Rakesh Gupta for giving me this opportunity to talk about this topic and this platform for sharing my views and ideas here. I would like to thank Platikin, Prepreg, and Slidego for their infographics and images that they've given me, and also my tech team for this technical help. And thank you all for listening to me. If you all have any question, you all can just email it to me anytime or you all can get back to me. I'll be more than happy to help. Yeah? Thank you.
Thank you so much, ma'am, for this wonderful presentation. Now, I would request our one and only Dr. Rakesh Gupta, sir, to just give in a few words of encouragement and thanks.
Thank you, Dr. Neha. It was a wonderful session, and I think it was a great thing to carry home, especially considering the different aspects of mental state examination and how do we interpret in the language of rubric. That is what we require, and that is what is the day-to-day thing which we would implement in our practice. So thanks a lot, and it was a wonderful session, and I was listening the entire session, and it was really a what we can say a revision for me, uh, and how you beautifully correlated by giving example and making it in an interactive session. So that is what I enjoyed about it, and thanks a lot. And I think all the participants were also deeply absorbed, and they were listening to this session carefully. So I would like to thank Dr. Neha Patel on behalf of Satru and the entire team. I would like to thank Dr. Yarish Sabri and Dr. Sagar Doshi to conduct this session in a beautiful manner. Thanks a lot. Right now, I would like to tell Dr. Yarish Sabri to take over for the vote of thanks.
Thank you, Dr. Neha Patel, ma'am. Thank you for so much, explaining this young generation about mental status examination and how to correlate with the homeopathic repertories with the wonderful rubrics of mind and generalities. Thank you, ma'am, once again for the enlightening session. I would like to thank Satwa Charitable Sanstha for giving this platform to nurture and help budding homeopaths by giving them a new direction. Lastly, I would like to thank my audience for being patient listeners. Hope you all enjoyed this session. We'll be having many such sessions. Thank you and have a lovely evening.
Thank you, everyone. Hope you'll enjoyed it.